Edward Sawyer Cooper, born 1926, couldn't find any resources on whether he's alive or dead. African American cardiologist. Cardiologist Edward Sawyer Cooper has done extensive research into strokes and stroke prevention, especially among African Americans. He has published numerous articles on this subject, as well as on heart disease and the incidence of high blood pressure in poor. Cooper was the first African American to head the American Heart Association, serving as president from 1992 to 1993. He was also the first black tenured professor of medicine at the University of Pennsylvania School of Medicine, the oldest medical school in the United States. Cooper has used his position to encourage minorities to pursue careers in the medical profession. Cooper was born on December 11, 1926, in Columbia, South Carolina, to Henry Howard Cooper Sr. and Ada Sawyer Cooper. Cooper's father was a dentist, and both of his brothers pursued careers in dentistry. After graduating first in his class from Columbia's Booker T. Washington High School, Cooper entered Lincoln University in Pennsylvania. He graduated with a bachelor's degree in 1946. Then he entered Meharry Medical College in Nashville. Cooper earned his medical degree in 1949, again graduating first in his class. Meharry honored Cooper with the Hartley Gold Medal that year. With his degree in hand, Cooper returned to Pennsylvania. In 1949, Cooper began his year-long internship at Philadelphia General Hospital. While working there, he had a patient who suffered a debilitating series of strokes. This woman was still young, less than 40 years old. But the strokes robbed her of speech and use of one side of her body. This experience inspired Cooper to become a cardiologist, a doctor who specializes in heart disease, high blood pressure, and strokes. After completing his internship, Cooper worked a residency in cardiology at Philadelphia General Hospital until he joined the United States Air Force in 1954. From 1954 to 1956, Cooper was the chief of the Air Force's regional hospital in the Philippines, reaching the rank of captain. Cooper then returned to accept the year-long National Heart Institute Fellowship in Cardiology, again at Philadelphia General Hospital. He also opened his own private practice. He became certified by the American Board of Internal Medicine in 1957. In 1958, Cooper became a staff member at Philadelphia General Hospital as well as a faculty member at the University of Pennsylvania School of Medicine. A year later, in 1960, he was named a Master of the American College of Physicians. Cooper directed Philadelphia General's Stroke Research Center, which opened in 1968 with a federal grant of $1 million. He retained this position until the center was closed in 1974 when federal funding was cut. In 1969, Cooper moved his private practice to the hospital at the University of Pennsylvania, where he was also a staff member. That year, he became president of the medical staff at Philadelphia General, an office he held until 1971. Throughout the 1970s, Cooper held other professional positions and won several awards. From 1970 to 1984, Cooper was a member of the Council of the College of Physicians of Philadelphia, and he returned to his post in 1994. In 1971, Meharry Medical College honored Cooper with the Distinguished Alumni Award. He became Chief of Medical Service at Philadelphia General in 1972, a position he held until 1976. Cooper won the Charles Drew Award for distinguished contributions to medical education in 1979. Cooper was associated with the American Heart Association for over 25 years, before being elected to his year term as president in 1992. Cooper had been a board member, the chairman, and the director of the American Heart Association's Stroke Council. He also chaired the Credentials and Nominating Committee, as well as the Writing Committee. The latter produced an important scientific paper, quote, Cardiovascular Disease and Stroke in African Americans and Other Racial Minorities, unquote. In 1986, Cooper was given the association's Award of Merit, When Cooper became the American Heart Association's first black president, he used his position to advocate for health education and the national healthcare system. He argued that prevention and early treatment are less costly and better for the patient. One of his main goals was increasing the number of people receiving treatment for high blood pressure. When he took office, only half of people suffering from high blood pressure were receiving treatment. Quote, "Access to health care is something that Americans want," unquote. He told Ebony, quote, "It's a political process. Reducing disability and deaths from cardiovascular diseases and strokes are a part of our mission," unquote. Throughout his career, Cooper has been active in other professional and civic organizations, using his position to promote better treatment and prevention of strokes, as well as to encourage minorities to become medical professionals. Cooper is a fellow of the American College of Physicians, and he belongs to the American Medical Association, the National Medical Association, the Association of University Professors, and the Alpha Omega Alpha. Cooper chaired the Talent Recruitment Council for the National Medical Association, an organization of African American doctors. Cooper was also a founding member and one-time chairman of the Executive Committee of American Health Education for African Development and the American Foundation for Negro Affairs. He has served on numerous editorial boards, including a consulting editorship for Stroke, and he has won numerous awards. Cooper married Dr. Jean Mary Wilder, and with her had 4 children: Edward Sawyer Cooper Jr., who died at a young age; Lisa Cooper Huggins, a pediatrician; Jan Cooper Jones, an endocrinologist; and Charles Wilder Cooper, a psychologist. He is currently Professor Emeritus of Medicine at the University of Pennsylvania School of Medicine. Citations are in the description.